Welcome to OET Answers.
Your preparation time is over. You can now start your role play.
Don't worry if I stop you when the time is up.
Good afternoon. My name is Narso Andrew, one of the registered nurses working in this emergency department. How may I help you today?
Nurse, I have experienced breathlessness and persistent coughing lately.
I'm sorry to hear that. Before proceeding, can I have your name and age for documentation?
Yes, my name is Patricia and I am 58 years old.
Thank you for the details. I understand you've been having some difficulty breathing. Can you tell me more about your symptoms?
Yes, Nurse Andrew. It began about 3 months ago and recently my cough has gotten worse. I find it harder to catch my breath, especially when I'm doing anything physical.
I appreciate you sharing that, Patricia. Can you elaborate on any specific triggers or patterns you've noticed with your symptoms?
It seems to get worse with smoke exposure and in cold weather. Lately I've been waking up in the middle of the night with a persistent cough.
Thank you for providing those details. How would you describe the nature of your cough? Is it mostly dry or do you bring up any phlegm?
It's mostly dry. But I do bring up some clear white phlegm at times.
Got it. Besides the cough, have you noticed any chest pain, wheezing, or increased fatigue?
No chest pain, but there is wheezing, especially when I exert myself. And yes, I've been feeling more tired than usual.
I appreciate you sharing all of that, Patricia. Based on your symptoms in the initial examination, it seems you may be dealing with an exacerbation of chronic obstructive pulmonary disease (COPD). I recommend further evaluation and hospitalization for closer monitoring and appropriate treatment. I understand it might be concerning, but it's essential for your well-being. Do you have any concerns or questions?
Admitting to the hospital, I was hoping to give some medication and go back home.
I don't like staying in hospitals.
I understand, Patricia, being in the hospital can be challenging, but it's crucial for managing COPD effectively. Let me explain why the hospital decision is necessary and address any concerns you may have.
Well, I prefer being at home. Hospitals make me uneasy.
I understand your concerns, Patricia. COPD can be a serious condition, and in some cases, hospitalization is the best course of action to manage it effectively. May I ask what specifically concerns you about staying in the hospital?
Well, I prefer the comfort of my home, and I'm worried about the hassle of being in the hospital.
I completely understand your feelings. Being in the hospital may seem inconvenient, but it's crucial for your well-being. COPD can be unpredictable, and being in the hospital allows us to closely monitor your condition, provide timely interventions, and ensure your comfort. It also allows us to administer treatments more efficiently than if you were at home.
I'm just scared of being away from home and all the medical stuff.
I empathize with your feelings. It's entirely normal to feel uneasy about being away from home. Given your current health situation, untreated COPD can lead to severe attacks. Managing such issues at home might be challenging, especially if you encounter significant difficulties. However, choosing to stay in the hospital allows us to address your symptoms more effectively, administer necessary treatments promptly, and closely monitor your progress. This approach substantially minimizes the risk of complications and ensures your safety throughout the treatment process. I trust that the information is clear to you.
Yes, I guess you're right.
It's just hard for me to accept.
I appreciate your honesty, Patricia. I want you to know that our team is here to support you every step of the way. We'll do our best to make your hospital stay as comfortable as possible, and we'll work together to address any concerns you may have. Your health and well-being are our top priorities.
Okay, Nurse Andrew.
I'll trust your judgment and stay in the hospital.
Thank you, Patricia. Your cooperation is vital for us to provide you with the best care possible. If you have any questions or concerns during your stay, please don't hesitate to let us know. We're here to help you through this process.
Thank you, nurse.
That is the end of your OET speaking roleplay. All the best.
Thank you, Patricia.
Thank you for watching. Kindly comment your suggestions and help us do better.